These forced birther states are harming women. They say that they're pro-life, but women are dying. There has been a dramatic increase in maternal mortality in places like Texas simply because doctors are afraid or because women have to be on the verge of death before doctors will swoop in and help women. So this article is titled "A Dramatic Rise in Pregnant Women Dying in Texas After Some Abortion Ban." Now, this article did come out September 20th, but this is a hot button topic that needs to be hammered home. When we say that women need to get out and vote like your life depends on it, we're not being overly dramatic. All right, so let's get into this article. It says the number of women in Texas who died while pregnant during labor or soon after childbirth skyrocketed following the state's ban on care, far outpacing a slower rise in maternal mortality across the nation, a new investigation of federal public health finds. From 2019 to 2022, the rate of maternal mortality cases in Texas rose by 56%, compared with just 11% nationwide during the same time period, according to analysis by the Gender Equity Policy Institute. The nonprofit research group scoured publicly available reports from the Centers for Disease Control and Prevention and shared the analysis exclusively with NBC News. There's only one explanation for the staggering difference in maternal mortality, said Nancy L. Cohen, president of the GEPI. All of the research points to Texas's abortion ban as a primary driver of this alarming increase. Texas, I fear, is a harbinger of what's to come in other states. The SB 8 effect. The Texas legislature bans abortion care as early as 5 weeks into pregnancy in September 2021, nearly a year before the U.S. Supreme Court overturned Roe v. Wade, the case that protected federal rights to abortion in June 2022. At the time, Texas Governor Greg Abbott, Republican, lauded the bill as a measure that ensures the life of every unborn child. Texas law now prohibits all terminations except to save the life of the mother. The passage of Texas's Senate Bill 8 gave GEPI research the opportunity to take an early look at how the near total bans on abortion, including cases in which the mother's life was in danger, affected the health and safety of pregnant women. The SB 8 effect, Cohen's team found, was swift and stark. Within a year, maternal mortality rose in all racial groups studied. Now, let's look at this graph for maternal mortality rates based on Black, Hispanic, and white women during these specific years. This blue right here, the third line for Black women, look how high it is compared to the third line of Hispanic women and the third line of white women. If you are a Black woman, having SMECs out in Texas just seems like, a mixed bag. Because they are already letting you know that they will let you die there. And these are deaths per 100,000 live births. So this is ridiculous that Black women are so much higher in these categories. So this is the latest one, 2022. It did drop from 2021, but look how dramatically different it is from the Hispanic drop and what it looks like white women's maternal mortality rates are increasing in Texas. So that's kind of wild that they're actually increasing, but it just goes to show that this needs to be looked at. These deaths are real life people, and a lot of women that are dying, the women that would be seeking abortion, are women who already have kids. So they're leaving behind children that won't have a mother to take care of them anymore, all because of these forced birthers. Among Hispanic women, the rate of women dying while pregnant during childbirth or soon after increased from 14.5 maternal deaths per 100,000 live births in 2019 to 18.9 in 2022. The rates among white women nearly doubled from 20 per 100,000 to 39.1, and Black women, who historically have higher chances of dying while pregnant during childbirth or soon after, saw their rates go from 31.6 to 43.6 per 100,000 live births. While maternal mortality spiked overall during the pandemic, women dying while pregnant or during childbirth rose consistently in Texas following the state's ban on abortion, according to the Gender Equality Policy Institute. If you deny women termination care, more women are going to be pregnant and more women are going to be forced to carry a pregnancy to term. Beyond the immediate dangers of pregnancy and childbirth, there is a growing evidence that women living in states with strict laws, such as Texas, are far more likely to go without prenatal care and much likely to find an appointment with an OBGYN. Texas is running these physicians out of the state. There's all kind of issues going on with trying to get care in Texas. Doctors say the feeling among would-be moms is fear. Fear is something I never seen in practice prior to SB 8, said Dr. Leah Tatum, an OBGYN in private practice in Austin, Texas. Tatum, who was not involved with the GEPI study, said that requests for sterilization procedures among her patients doubled after these forced birther bans. That is, women prefer to lose their ability to ever have children over the chance that they might become pregnant following SB 8. Patients feel like they're backed into a corner. If they already knew that they didn't want to pursue pregnancy, now they're terrified. I want to also remind us all that Texas won the right to basically let women die instead of giving them an emergency termination to a pregnancy. They won that right in Texas. So they will let you die versus giving you the care that you need because they're so pro-life in Texas. So this is titled, U.S. Supreme Court Lets Stand a Decision Barring Emergency Terminations That Violate the Texas Ban. The Supreme Court on Monday let stand a decision barring emergency terminations that violate the law in Texas, which has one of the country's strictest bans. Without detailing their reasoning, the justices kept in place a lower court order that said hospitals cannot be required to provide pregnancy terminations that would violate Texas law. The Biden administration had asked the justices to throw out the lower court order, arguing that hospitals have to perform these terminations in emergency situations under the federal law. The administration pointed to the Supreme Court's actions in a similar case from Idaho earlier this year, in which the justices narrowly allow emergency terminations to resume while a lawsuit continues. The administration also cited a Texas Supreme Court ruling that said that doctors do not have to wait until a woman's life is in immediate danger to provide a termination legally. The administration said it brings Texas in line with federal law and means the lower court ruling is not necessary. Texas asked the justices to leave the order in place, saying the state Supreme Court ruling meant Texas law, unlike Idaho's, does have an exception for the health of a pregnant patient, and there's no conflict between federal and state law. Doctors have said the law remains dangerously vague after a medical board refused to specify exactly which conditions qualify for the exception. There has been a spike in complaints that pregnant women in medical distress have been turned away from emergency rooms in Texas and elsewhere as hospitals grapple with whether standard care could violate strict laws. Pregnancy terminations have long been part of the medical treatment for patients with serious complications as a way to prevent sepsis, organ failure, and other major problems. But in Texas and other states with strict bans, doctors and hospitals have said it's not clear whether those terminations could run afoul of bans that carry the possibility of prison time. The Texas case started after the Supreme Court overturned Roe v. Wade in 2022, leading to restrictions in many Republican-controlled states. The Biden administration issued guidance saying hospitals still needed to provide care in emergency situations under the healthcare law that requires most hospitals to treat any patients in medical distress. Texas sued and said, we're going to let people die, and the Supreme Court upheld that. They said, yes, you can let women die because you're so pro-life that you want women to die. And that is what is on the ballot. Texas is on the ballot. These forced birther states are on the ballot. There could be another Supreme Court justice up for nomination after this election. So that is also up for grabs. Please vote like your life depends on it. Like, comment, and share.